The Department of Health has pulled the trigger on a rather controversial policy to cut quarantine and recovery time of positive cases who are fully jabbed and have exhibited mild symptoms. PTV's Mark Fetalco on a 7-day quarantine and isolation period for such positive cases to avert the crippling decimation of the ranks of our medical frontliners and other professional sectors in this report.
The Department of Health updated its guidelines on quarantine and isolation periods. Fully vaccinated COVID-19 patients who are asymptomatic or experiencing mild symptoms should isolate for 7 days from the onset of symptoms, while the 10-day isolation for those who are partially vaccinated and unvaccinated remains.
That the viral RNA from respiratory samples was highest on 3 to 6 days after diagnosis or symptom onset, and samples were then observed to have a marked decrease after 10 days since diagnosis or symptom onset. Findings also show that vaccinated asymptomatic and mild cases are unlikely to shed infectious virus 10 days after the diagnosis or symptom onset.
Those who experience moderate symptoms need to isolate for 10 days regardless of their vaccination status, while severe and critical cases will have to isolate for 21 days.
We actually want to count our number of days of isolation from the day that symptoms started, because we recognize that there are instances where testing is significantly delayed.
The quarantine period for the fully vaccinated close contacts will also be shortened from 7 days to only 5 days. The DOH said the IATF has yet to approve the updated guidelines. Meanwhile, individuals under the A1, A2, and A3 categories will be given prioritization for RT-PCR testing, while for the rest of the population, isolation and symptom monitoring will be prioritized over testing.
Should testing still be used, testing should be done at least 5 days from the day of exposure. Testing should not be recommended for screening asymptomatic individuals.
Amid the surge in COVID-19 cases, Treatment Czar Leopoldo Vega said the One Hospital Command Center is receiving as many as 1,120 calls per day. This from the 98 to 112 calls per day received by the referral center in the first weeks of December last year.
In September of last year, ang number of calls namin ay talagang referrals and sa mga hospitals for intensive care units, especially yung yung nagkakaproblema din in terms of the distribution of oxygen supply at the time. So yun ang ating nakita noong September. Ito ngayon January, nakita natin na yung mga tawag mostly on the isolation facilities, home isolations.
Vega added the healthcare utilization rate in Metro Manila is at 60%, while the hospitalization in the NCR nears the moderate level. The DOH said some 3,000 government health workers in the region have been isolated due to COVID-19. Vega noted how some hospitals have been closing certain non-COVID services to reallocate personnel to COVID-19 operations. Mark Fetalco for The Nation.